Why you need to increase hemoglobin. We will talk about hemoglobin in this video. Number 1. What foods we need to take or increase. Number 2. Symptoms of lack of hemoglobin. Number 3. How to get better absorption of the required nutrients. Always consult your healthcare professional before making any changes to your medication or lifestyle. Symptoms of lack of hemoglobin. A lack of hemoglobin, a condition known as anemia, can result in various symptoms. Hemoglobin is a protein in red blood cells that carries oxygen from the lungs to the rest of the body. When hemoglobin levels are low, the body may not receive an adequate supply of oxygen, leading to the following symptoms. Fatigue. One of the most common symptoms of anemia is persistent fatigue or weakness. The body's cells may not receive enough oxygen to function optimally. Pale skin. Reduced hemoglobin levels can lead to paleness in the skin, particularly noticeable in the face, palms, and nail beds. Shortness of breath. As the body tries to compensate for the lack of oxygen, individuals with anemia may experience shortness of breath, especially during physical activity. Dizziness or lightheadedness. Anemia can affect blood flow, leading to feelings of dizziness or lightheadedness. Cold hands and feet. Poor circulation resulting from anemia can cause extremities to feel cold. Headache. Inadequate oxygen delivery to the brain may cause headaches. Irregular heartbeat. Palpitations. Anemia can lead to a faster heart rate or an irregular heartbeat as the heart tries to pump more blood to compensate for the lower oxygen carrying capacity. Chest pain. Severe anemia may strain the heart, leading to chest pain. Brittle nails. Changes in the nails, such as brittleness or spoon-shaped indentations, can be associated with anemia. Poor concentration and cognitive issues. Insufficient oxygen to the brain can affect cognitive function, leading to difficulty concentrating and memory problems. It's essential to note that you might get only few of the symptoms. The specific symptoms can vary depending on the underlying cause of anemia. There are various types of anemia, each with its own causes and manifestations. If you suspect you may have low hemoglobin levels or are experiencing symptoms of anemia, it is important to consult with a healthcare professional for a proper diagnosis and appropriate treatment. Increasing hemoglobin. Increasing hemoglobin levels typically involves making changes to your diet, lifestyle, and, in some cases, taking supplements or medications. Here are some general tips. Iron-rich foods. Include iron-rich foods in your diet such as red meat, poultry, fish, beans, lentils, tofu, fortified cereals, and green leafy vegetables like spinach. Vitamin C intake. Consume foods rich in vitamin C alongside iron-rich foods. Vitamin C enhances the absorption of non-heme iron, found in plant-based foods, in the body. Citrus fruits, strawberries, tomatoes, and bell peppers are good sources of vitamin C. Vitamin B6 and B12. Foods rich in vitamin B6 and B12 are also important for healthy blood production. These vitamins are found in meat, fish, poultry, eggs, dairy products, and fortified cereals. Folate, vitamin B9. Foods high in folate include leafy green vegetables, beans, lentils, avocados, and fortified cereals. Avoid iron blockers. Certain substances can hinder iron absorption. Avoid drinking tea or coffee with meals, as they contain compounds that can inhibit iron absorption. Calcium-rich foods and supplements may also interfere with iron absorption, so it's advisable to separate their intake. Cook in iron pots. Cooking in iron pots can increase the iron content of your food. Stay hydrated. Drinking an adequate amount of water is essential for maintaining overall health, including blood health. Iron-rich foods. Here's a general overview of the iron content in various food sources. Animal sources: fish and meat per 3 ounces, approximately. Beef, 2.1 mg of iron. Lamb per 3 ounces, approximately 1.2 mg of iron. Pork per 3 ounces, approximately 0.7 mg of iron. Chicken per 3 ounces, cooked, approximately 0.9 mg of iron. Turkey per 3 ounces, cooked, approximately 1.2 mg of iron. Fish iron content. Tuna 1.0 mg. Salmon 0.5 mg. Sardines 2.2 mg. Mackerel 1.63 mg. Salmon 0.25 mg. Plant sources per cup, cooked. Lentils, 6.6 mg of iron. Kidney beans, 5.2 mg of iron. Chickpeas, 4.7 mg of iron. Black beans, 3.6 mg of iron. It's important to note that the iron content can vary based on factors such as the cooking method and the specific type or cut of meat. Additionally, the iron in plant-based sources, like beans and lentils, is non-heme iron, which is not as easily absorbed by the body as the heme iron found in animal products. Better absorption. Combining non-heme iron sources with vitamin C-rich foods can enhance absorption. For example, squeezing lemon juice over lentils or having a tomato salad with beans can help increase iron absorption. Avoid excessive tea and coffee. Excessive consumption of tea and coffee can interfere with iron absorption. Consider supplements. If dietary changes are not sufficient, your healthcare provider may recommend iron supplements. However, it's crucial to consult with a healthcare professional before taking any supplements, as excessive iron intake can have adverse effects. Treat underlying conditions. If anemia is caused by an underlying medical condition, such as gastrointestinal bleeding or chronic kidney disease, treating the primary issue is essential. Always consult with a healthcare professional before making significant changes to your diet or taking supplements, as they can provide personalized advice based on your specific health needs. If you're experiencing symptoms of anemia or have concerns about your hemoglobin levels, it's important to seek medical advice for a proper diagnosis and treatment plan. Do not forget to click the like button and subscribe. Thanks very much for watching this video. Up above you see a video related to health. It will be more helpful to you and your family. Subscribe to my channel. See you in the next video.